My name is Henry and I'm a certified veterinary technician here at Pearl Animal Hospital. And today I want to talk to you guys about administering subcutaneous medications at home. So medications given subcutaneously, it is an injection that you would be giving at home. And subcutaneously basically means just right under the skin. So you're not going into any muscle or you're not going into any veins, it's just going right under the skin. And it's actually a pretty easy way for owners to administer medications to their pets at home. There's a lot of different reasons why you may be directed to administer subcutaneous injections for your pet. It could be for supplemental vitamin administration, it could be for insulin administration, or in some cases it could be to administer pain medications that your doctor has prescribed. So I'm going to go ahead and just give you a quick rundown of how to prepare injectable medications, how to draw them up and handle the syringes. And then we'll go ahead and we'll have a patient come in so we can give you a live demonstration of the areas that you can give subcutaneous injections and actually see how easy it is to actually administer these injections yourself at home. So when your veterinarian prescribes subcutaneous injectable medications for home use, they're going to select a syringe size that's appropriate for use. There's a couple of different options available, but usually you will either be prescribed a 1 cc tuberculin syringe, or you'll be prescribed a insulin syringe, depending on the type of medication that you're going to be giving. So we'll go ahead and I'll show you with both of these syringes. These are the most common ones. For today's demonstration, I'm going to go ahead and give an injection of vitamin B12. This is a very common medication that will be prescribed for home use for a variety of reasons. So anytime you have an injectable medication, you want to store them in a cool, dark place out of direct sunlight. This bottle is amber colored, so it is already protected from light, but we still just want to keep it out of direct sunlight. If you're administering insulin, you're going to want to store that as according to package directions, which we'll talk about a little bit later in a different video for insulin administration. So the first thing that we're going to do is we're just going to take a quick glance at our bottle. We're going to make sure that there's nothing floating around in it, that the solution inside is clear, you can see through it. We're going to check the expiration date on our bottle, make sure that our drug is not expired. And then we're going to go ahead and clean our vial top. Since we're injecting the medication directly into the pet, we want to make sure that this is as clean as possible. So what you can do is just take a little bit of isopropyl alcohol, some gauze squares, or even just the alcohol wipes that you can get at any pharmacy. And you're just going to go one pass over the bottle top, and then you're going to go over the other side, and then you're going to let that air dry. While that's air drying, you're going to go ahead and prepare your syringe. So to prepare the 1 cc syringe, all you got to do is just pop it out of the packaging like so. And we're going to go ahead and carefully take the cap off the needle. So we'll set that down. Now, when we are puncturing the medication vial, we're going to hold the vial upside down, and we're going to puncture right in the center of it. And as I draw back on the plunger, I'm going to go ahead and pull back past the prescribed dose. So we're going to give 0.4 milliliters, and the syringe is calibrated. Since this whole syringe holds 1 cc of medication, each point on the syringe is going to hold 1/10 of a cc. So I'm going to pull back more than what I actually need. I'm going to support the syringe with the palm of my hand, and I'm just going to kind of give it a good tap just to remove any air bubbles. And then we're going to push the drug back into the bottle that I don't need. And we're going to stop the plunger right at 0.4. And then we're just going to go ahead and pull the whole syringe and needle assembly right out of the vial. We'll go ahead and carefully replace the cap on the needle. And then we'll double check our dose. So that is 0.4 cc's of vitamin B12. To go ahead and draw up the prescribed dose with the insulin syringe, if you're prescribed insulin syringes for home use, your medication directions are going to be measured in units instead of milliliters or cc's. The insulin syringe comes in a plastic casing, and to remove it from the casing, you're just going to hold the plastic case and you're just going to push down on the orange syringe cap. That will pop the cap off the back of it, and the syringe will come out of the plastic case that you can then dispose of. I'm going to go ahead and wipe my bottle one more time. Now, with insulin syringes, this whole syringe actually holds the same volume as this tuberculin syringe. They're exactly the same. They're just calibrated a little bit differently. So for this syringe, if we wanted to give 0.4 cc's, we're gonna use 40 units, which 40 units would be right there. So each line on this syringe is 1 unit. We've got increments of 5s on one side and increments of 10 on the other side. Another method that may be demonstrated in your clinics to draw up injectable medications is to pull up the prescribed dosage in air before puncturing your vial. So for this one, we want 40 units. We're gonna pull the plunger back to 40 units before we puncture the vial. We'll go ahead and take the cap off, invert the bottle, insert the needle right in the center of the stopper. We will go ahead and inject 4 cc's of air, and then we're gonna go ahead and draw back past what we actually need. We'll go ahead and anchor the syringe again, give it a little flick just to remove and loosen any air bubbles. And then we're gonna push back the drug that we don't need, and we're gonna line up the plunger right at 40 units. So we'll go ahead and remove the syringe from the bottle, carefully replace the needle cap, and we have 40 units of vitamin B12. So again, 40 units is exactly the same as 4 cc's. The one thing I want to mention is that if you're using insulin, it is extremely important to use the prescribed syringes with the insulin because the syringes are calibrated so differently, and interchanging those syringes can cause potentially fatal errors. So make sure you're using the syringes that are prescribed for the medication you're going to be giving. If you have any questions, ask your veterinarian or veterinary technician for any clarification before administering injections at home. So now that we have our drugs already prepared and ready to go, I'm going to go ahead and run back and get our patient, and then we'll go ahead and show you guys how to administer a subcutaneous injection. So administering injections subcutaneously, we have a lot of different options. So subcutaneous, again, means just right underneath the skin into the subcutaneous space, which is basically anywhere on your animal where you can pull and lift a tent of skin. So the most common areas for subcutaneous injections at home are going to be between the shoulder blades, right in this area, right on the shoulder, right here, or on this side, and in some cases you can also use the rear legs, so right here or here. I tend to look at this area of my patients as a little bit more of a comfortable zone for injection administration. They seem to tolerate it a little bit better. The further down the spine you get, it gets a little bit more sensitive, and then it starts to decrease in sensitivity again on the back legs. But for this purpose, we're gonna go ahead and do it between the shoulder blades. So I've got Bogey here, and I've got my 40 units of vitamin B12. And what I'm gonna do is I'm just gonna go ahead and tent the skin, just like so. So what I like to do is take my fingers in kind of a triangular shape, pinch the skin here, and then with my index finger, I'm kind of flattening down the skin so that I have a nice flat area right here where I can go ahead and administer my injection. When I go ahead and insert the needle, what I'm going to want to do is I'm going to want to keep the syringe parallel to the spine. That way we're not going downward like this, we're not coming towards us, we're not going away, we're just keeping it nice and parallel, and that will keep things all lined up and make sure that it goes right into the subcutaneous space. After I puncture the skin with the needle, I'm going to go ahead and gently pull back on the plunger of the syringe just to make sure that I'm not getting any air. If you get air, then that means you've probably gone through the other side of the skin, which is a very common error when administering these injections. And all you do is simply remove the needle and repoke in a different location. The other thing that we're looking for is we're making sure that we're not getting any blood in our syringe, because that would indicate that we've either hit a small little vessel or entered a vein. When giving subcutaneous injections, the likelihood of that is extremely, extremely low, and I've actually never seen it happen since I've been practicing, but it's not to be completely ruled out. So we'll go ahead and administer this injection and see how Bogey does. So what I'm going to do is I'm going to tent the skin, and now I do want to make the disclaimer, this is my dog, and I do know his temperament very, very well. So if you don't know how your pet is going to tolerate the injection, you're going to want to make sure that you have a helper or somebody else just to make sure that they're kind of holding and protecting you so that you can't get bitten, so that the pet's not injured and nobody else is injured. For a subcutaneous injection, if you were having somebody else hold for you, what I would do is I would have the pet standing up, and then we would put a hand underneath the lower abdomen, and then pull their head into your shoulder just so that you have good control of the head. And that's usually good enough restraint just to be able to get that injection in. So what I'm going to do is I'm going to go ahead and take the cap off my needle. I'm going to tent the skin like we discussed, and I'm going to insert the needle parallel to the spine. I'm pulling back to check for the presence of blood or air, and then we're going to go ahead and depress the plunger, administering the dosage of medication. We'll pull straight out like so. We can see that my medication is no longer in the syringe. There's no wet spots, so I know that it all went into bogey. And then I'm just going to take the whole syringe assembly and I'm going to place it into a red sharps container. And if you are prescribed injectable medications at home, your veterinary provider will make sure that they send you home with a sharps container. That's pretty much all there is to it. Again, if you ever have any questions or just need a refresher, feel free to give us a call, shoot us an email, request a technician appointment for an injection demonstration, and we'll make sure that you're going ahead and administering these medications in the safest manner for your pet. As always, we look forward to seeing you guys, and if you have any questions, feel free to email us at ask_us@pearlanimalhospital.com. Talk to you guys soon.